and welcome in again to Your Health. And we love this community. We have Dr. Lou Lambiasie, who you met previously, doing some wonderful things. And Dr. Lambiasie, you came December?
December, yeah.
December. We're beginning to move into your first year almost.
I know. Time flies. Huh?
I love it. As the dean of our Montgomery Regional UAB Medical School, which is housed right there next to Baptist South. And actually, how did we wind up being so blessed to get a UAB medical school here?
Well, there's been medical education in Montgomery since the 70s. We've had an internal medicine training program and a family medicine training program based at Baptist. And, there's been a thought at UAB, which, one of the goals of UAB is to produce physicians for the state of Alabama, is that they wanted to expand out of the Birmingham area and into the river region. And so around the late 2010s, around then, there was a decision to put a campus here and to house students in their clinical training. So I think in about 2012, there was a decision made to house the campus here. We got our first students in 2014.
Right.
We have the third year students here. So in medical school, the first 2 years are basically in the classroom, learning all the science and physiology about being a doctor. And then you move after in your third and fourth years into more practical and being clinical. So we house them in their clinical years, in their third and fourth years. And so 2014, we had the first people come. 2015 was our first graduating class. And so we've had 6 or 7 graduating classes. And so that's how it came to be.
Well, it's just, I know that Baptist fought very hard to have this selected. And I think, there is nobody out there that does not know that we have got a really, what I consider critical, from my point of view, shortage of both doctors and nurses. And one of the wonderful things and one of the goals that you have with having this medical school here is to make this a community that these young doctors want to come back to. And what, tell me about what can our community do to help with that?
Well, I think it's right. It's critically important that we have physicians here. Unfortunately, physicians get older and they have to retire and move on, and so you have to replace the physicians. Plus, as the population grows and ages, you need more doctors. So one of the main purposes of the campus is to expand the healthcare offerings in Montgomery, to make it so that we can do things here in Montgomery where you don't have to take the day off and travel to Birmingham, or that you can stay here. And so what we're trying to do is make this an attractive place and to keep doctors here. So we've had, right now, we've had 4 of our graduates have come back to practice in Montgomery, and that sounds like it's a little, but if you remember, it takes 3 to 7 years after they graduate to finish their training. So after you're done with your medical school, there's still more training going on. I personally had 6 years after I finished to come back and be a gastroenterologist. So it's going to take some time to recruit people back. The other thing that's interesting about the campus is some doctors are looking for the opportunity to teach. And so having the campus here and having the educational program has helped us recruit doctors. We have had several internal medicine doctors who have come to our community just because they've had the opportunity to teach the residents and the students. And so we're looking to build on that. The community can help by encouraging their doctors to teach. I mean, we have a lot of our doctors are volunteer preceptors. They're working very, very hard to take care of the patients. And then this is an added duty. They have to take this seriously. You have a lot of knowledge in your head, but like anything else, teaching is a skill, and to do it well requires some effort. And so, in my opinion, the best doctors teach, so it's a mark of quality. So if you go to your physician, ask if they teach, and if they don't, ask them why. And really, you should use it if somebody's involved with the medical school. We've vetted them. They've tried. They've made a commitment to stay up on their medical knowledge. To me, that's a mark of quality. So
yes.
So I think the simplest thing that you could do as a community member to support medical education is to select physicians who participate in it.
Well, and support those physicians who do.
That's
who
right.
want to, because it benefits all of us. You know, with the shortage that we have now, healthcare it's a difficult arena to navigate, and if we can get more doctors here and more of our good doctors that are already here to come and teach, it's just, to me, I can't imagine having that much knowledge in my head and not using it. You know, it just, we're not put here just to take up oxygen.
That's right.
So, well, we just thank you so much. And if you
just thrilled to be
ever need any help from us, you let us know.
Appreciate it.
Thank you for being here. Thank you for all that you do. And thank you again for giving those students training, not just in the medical field, but in doing what's right and in giving back. Because to me, it's a combination of CC, competence and compassion.
Well, being a physician is a tremendous honor, and hopefully we get to convey that to the students.
Well, I love the fact that you look at it as an honor, and we thank you. And thank you, folks, for being with us. Take good care of yourself. Take good care of your health. We'll be right back.